Ever wondered why a small paper cut stops bleeding after a while? It's all thanks to a process called blood coagulation. This process is a complex dance of cells, platelets, and proteins, all working together to form a clot that prevents you from losing too much blood. It's kind of like your body's own emergency repair kit. Now imagine if this process didn't work as it should. Perhaps the clot forms too slowly, or not at all, or maybe it forms when it shouldn't. These scenarios can lead to what we call blood coagulation disorders. These conditions can range from mild to severe, and they can affect people of all ages, from newborns to the elderly. So why does this matter? Well, understanding these disorders is the first step towards managing them effectively and ensuring a better quality of life for those affected. Stay tuned as we dive into the different types of blood coagulation disorders and their causes. You might be surprised to learn how intricate our bodies really are. First on our list is a well-known disorder, hemophilia, also known as the royal disease. This name was coined because the disorder was common in European royal families during the 19th and 20th centuries. Hemophilia is a genetic disorder, predominantly affecting males, that impairs the body's ability to clot blood. But what does that mean? Well, let's break it down. When we get a cut or a bruise, our body jumps into action, creating a clot to stop the bleeding. For someone with hemophilia, this process doesn't work as it should. Their blood doesn't clot effectively, leading to prolonged bleeding. This can be particularly dangerous if the bleeding occurs inside the body, such as in the joints or the brain. Now, what causes hemophilia? It's all down to genes. Hemophilia is caused by a mutation or change in one of the genes that provides instructions for making a protein needed for blood clotting. These proteins are known as clotting factors, and there are 13 in total. People with hemophilia have a deficiency in either factor 8, which leads to hemophilia A, or factor 9, which leads to hemophilia B. Symptoms of hemophilia can vary, depending on the severity of the factor deficiency. Someone with a mild deficiency may only have problems with bleeding after surgery or serious injury. However, those with a severe deficiency can bleed spontaneously, without any known injury or cause. Common symptoms include many large or deep bruises, joint pain and swelling, unexplained nosebleeds, and blood in the urine or stool. While hemophilia is a lifelong condition, treatments have come a long way. Today, people with hemophilia can lead full, healthy lives with the help of therapies like factor replacement therapy, which replaces the missing clotting factor in the blood. In conclusion, hemophilia is a prime example of how our genes can influence our body's ability to function correctly. It's a fascinating, albeit challenging disorder that highlights the importance of blood clotting in our daily lives. Next up, let's talk about the most common inherited bleeding disorder, von Willebrand disease. Named after the Finnish physician Erik Adolf von Willebrand, who first described it, von Willebrand disease is a lifelong bleeding disorder. It affects your blood's ability to clot. This is due to a deficiency or dysfunction of a clotting protein in the blood, known as the von Willebrand factor. So, what causes von Willebrand disease? In essence, it's all in the genes. This disease is typically inherited, meaning it's passed down from parents to their children through their genes. However, it's important to note that the severity and type of the disease can vary greatly, even among members of the same family. Unlike hemophilia, which we discussed earlier, von Willebrand disease doesn't discriminate between genders. Both men and women can inherit this disorder, making it a universal concern. This is one of the key differences that sets von Willebrand disease apart from other bleeding disorders. Now let's get into the symptoms. They can range from mild to severe, depending on the type and severity of the disease. Some people may not even realize they have it until a situation arises where their blood needs to clot quickly, like during surgery or after a major injury. Common symptoms include frequent nosebleeds, easy bruising, prolonged bleeding from minor cuts, heavy or prolonged menstrual bleeding in women, and occasionally blood in urine or stool. For some people, von Willebrand disease may not significantly impact their daily life. However, for others, it can pose serious health challenges and require regular treatment. So why is it important to know about von Willebrand disease? Well, understanding this disorder can help us better manage bleeding episodes when they occur, and it underscores the importance of a timely diagnosis. It also highlights the complexity of our body's clotting process and how even minor imbalances can lead to significant health challenges. Von Willebrand disease is a reminder that even common disorders can have complex causes and effects. Now, let's shift gears and discuss a disorder that causes too much clotting, thrombophilia. Thrombophilia, as the name might suggest, is a condition that heightens the propensity for blood clot formation. In the grand tapestry of blood disorders, thrombophilia is the overachiever, erring on the side of too much clotting rather than too little. But what exactly causes thrombophilia? It's a bit of a mixed bag. Some people are born with a genetic predisposition for the disorder, inheriting a tendency for excessive clotting from their parents. This is known as inherited or primary thrombophilia. Others acquire the condition later in life due to certain medical conditions or treatments, hence the term acquired or secondary thrombophilia. Now let's delve into the realm of symptoms. Thrombophilia is a bit of a silent operator, often showing no signs until a clot forms. These clots can manifest in various ways depending on where they decide to set up shop. For instance, if a clot forms in your leg's deep veins, it might cause deep vein thrombosis, leading to swelling, pain, and discoloration. If the clot travels to your lungs, it could result in a pulmonary embolism, with symptoms like shortness of breath, chest pain, or even sudden collapse. It's also important to note that thrombophilia can increase the risk of developing clots during periods of prolonged immobility, like after surgery or during a long flight. Women with thrombophilia may also experience complications during pregnancy, such as recurrent miscarriages or preeclampsia, a condition characterized by high blood pressure and potential damage to other organ systems. But remember, thrombophilia doesn't mean you're destined to live a life shrouded in clot-related fear. With the right medical guidance and management, it's entirely possible to lead a normal, healthy life. Thrombophilia shows that even when it comes to clotting, there can be too much of a good thing. And while our bodies need clotting to prevent excessive bleeding, thrombophilia reminds us that balance is the key to everything, even in our blood. Not all disorders are inherited. Some, like acquired coagulation disorders, can develop during one's lifetime. Just as the name suggests, these conditions are not passed down through families, but instead, they occur as a result of certain life situations or health conditions. So, what exactly is an acquired coagulation disorder? Well, in simplest terms, it's a condition that impairs the blood's ability to clot properly. But unlike inherited disorders like hemophilia or von Willebrand, these disorders are not present from birth. They develop later in life due to various factors. One of the most common causes of acquired coagulation disorders is a deficiency in vitamin K. This particular vitamin plays a crucial role in the production of certain proteins that help blood clot. So, when your body doesn't get enough vitamin K, it struggles to make these clotting proteins, which can lead to uncontrolled bleeding. This deficiency can result from a poor diet, certain intestinal disorders, or even long-term use of antibiotics. Liver disease is another significant cause of acquired coagulation disorders. You see, the liver is responsible for producing most of our blood clotting factors. So, when the liver is damaged or diseased, it can't fulfill this important job, leading to a higher risk of bleeding. Certain medications can also lead to these disorders. For instance, blood thinners, which are often prescribed to prevent heart attacks and strokes, can sometimes cause excessive bleeding. Symptoms of acquired coagulation disorders can vary widely, but they often include easy bruising, frequent nosebleeds, heavy or prolonged menstrual bleeding in women, and prolonged bleeding from minor cuts or injuries. Acquired coagulation disorders are a good reminder that our lifestyle and environment can have a significant impact on our health, not just our genes. They underscore the importance of good nutrition, maintaining liver health, and carefully managing medications. And as with any health issue, early detection and treatment are key to managing these disorders effectively. Acquired coagulation disorders remind us that our lifestyle and environment can affect our health just as much as our genes. So let's be mindful of our habits and our surroundings, for they play a significant role in our overall well-being. As we've seen, our bodies are incredibly complex and delicate systems. The intricate dance of blood clotting is a testament to this, and when this process goes awry, blood coagulation disorders like hemophilia, von Willebrand disease, thrombophilia, and various acquired disorders can occur. Hemophilia, a condition where the blood doesn't clot properly, can lead to severe bleeding. Von Willebrand disease, on the other hand, is characterized by deficient or defective clotting proteins. Thrombophilia is a condition that increases the risk of blood clots, while acquired disorders are typically caused by other diseases or conditions. Each of these disorders presents its own unique challenges, and understanding them is crucial. After all, knowledge is the first line of defense. It empowers us, equips us, and enables us to take better care of ourselves. always remember, understanding our bodies is the first step towards maintaining our health. Until next time, stay curious and keep learning.